Screencast forms part 5 of an introductory talk on psychoanalytic ideas which inform psychodynamic counselling. In the previous 4 parts, we considered some of Freud's ideas which are used to varying extents by psychodynamic counsellors and therapists today. Now we will look at 4 particularly influential developments in psychoanalytic thinking since Freud: attachment theory, containment, countertransference, and the internal world. Attachment theory explores the way that people develop their patterns of relating to others based on the way they attached to and trusted important people in the past, in particular their primary caregivers. Infants have been observed to exhibit secure, insecure, or disorganized patterns of attaching to their caregivers. These patterns appear to be fairly stable over time and seem to map onto our adult patterns of relating to our partners. They can cause problems in adult relationships, especially in times of stress, as for instance when one partner becomes insecure, clingy, and seeks reassurance, while the other wants emotional space and distance. Both may feel that their partner does not understand, respect, or respond to their needs. Containment is a psychoanalytic concept which refers to something which mothers do naturally for their infants. When the infant experiences feelings which threaten to overwhelm him, through his crying and distress, he communicates these feelings to his mother, who ideally is able to tolerate them, make sense of them, and respond appropriately. In a similar way, the therapist or counsellor aims to hear and acknowledge the client's anxiety and distress, to stay with these feelings in the counselling sessions, to bear them until they can be understood and thought about. Containment provides for an emotional experience of having anxiety and distress understood, as a step towards enabling the client to become more able to tolerate and understand these feelings in himself. Containment represents a significant difference between psychodynamic and other talking therapies, like cognitive behaviour therapy, which aim for only an intellectual understanding and mastery of emotional experience. Countertransference refers to the counsellor or therapist's responses and reactions to their clients. It can refer to their own unresolved transferences to people from the past, which they then transfer onto their clients. For this reason, it's generally considered necessary for psychodynamic therapists to have their own therapy, in order to protect against their own unresolved issues interfering with the help they offer their clients. Countertransference can also refer to feelings and reactions evoked in the therapist or counsellor by a particular client. This can give clues to the way that particular client relates to other people in life, and provides a window into the qualities and difficulties of their adult relationships. The final concept described here is that of the internal world. In psychoanalytic theory, we live in 2 worlds: the real outside world of people, work, and relationships, and an inner world, a psychological world, which feels just as real, but where people and relationships are coloured by earlier relationships and experiences, memories, beliefs and feelings. Difficulties arise for us when we perceive and act towards people in our outside world as if they were the same as these blueprints of people and relationships in our internal world. Psychodynamic counselling and therapy aims to help people to distinguish between these 2 worlds, and so respond to others and situations in a more appropriate way in life.